On December 14th, a nurse in New York became the first American vaccinated for COVID-19 outside of a clinical trial. That was 6 months ago. Now the discussion is all about boosters. Will we need them? And if so, when?
There will be a need for a booster somewhere between 8 and 12 months.
There's no set rule now that says in 6 months or in a year we're going to require a boost.
It's frustrating because people want to know how long immunity lasts, but it's just going to take time.
Dr. Amesh Adalja is an infectious disease physician with expertise in preparing for pandemics. He has served on government panels responding to public health emergencies, not unlike the one we've been in for the past year and a half.
What are you looking for as maybe some early clues that we would need booster shots?
I want to know what's happening to these patients clinically. Are they getting breakthrough infections? And are those breakthrough infections severe enough to land them in the hospital?
With some diseases like yellow fever, most people get lifetime protection from a vaccine. But for others, like influenza, we roll up our sleeves every year. Even among coronaviruses, it ranges.
The first SARS in 2003, it appears that those individuals who were infected naturally did develop long-standing immunity. It's a little bit different with the community-acquired coronaviruses because they're always causing common colds and they may be more tenacious to be able to cause reinfections.
Booster studies are underway. In some cases, boosting with a different COVID-19 vaccine or one that's been tailored to a specific variant.
Should we be worried that there will be a particular variant that may start to escape the protection of these vaccines?
I think it's very hard for a virus to mutate in such a way and to get the perfect mutations to be able to completely evade a vaccine, to make it worthless.
At the same time, we're hearing more and more good news about just how robust immunity to COVID-19 might be. 6 months out, both Pfizer and Moderna still have more than 90% efficacy against COVID-19. And even among people who've been infected, we're still seeing evidence of immunity a year later. And it's not just antibodies we're talking about.
The antibody arm that everybody knows about, and then there's a whole other arm which is called cell-mediated immunity. You will find T cells that are reactive to COVID-19 long after infection, and those may be really instrumental for how we determine when a booster is necessary.
But there may be some who may benefit from a booster sooner than others, like immunocompromised people. A recent study found that a third shot provided a boost to a small group of organ transplant recipients who had low antibody responses, including a third of them who had no detectable antibodies after the first 2 doses. But for many of us, the benefit is less clear-cut, an issue that becomes even more complicated when you start to look around the world.
If you've got this pandemic raging out of control in many countries where they can't get single doses into people, it really is going to be difficult to justify giving people a third dose.
So the good news is the boosters could be created pretty quickly. I mean, this technology for creating vaccines is pretty remarkable. Also, it's not clear that we need them right now. What we're seeing is that the vaccines work well. If you can get more and more people vaccinated, the virus will circulate less, there will be fewer mutations, and maybe we won't need boosters at all. These vaccines could last, be protective for a long time.